Hey, afternoon, everyone. Welcome to our lunchtime webinar with Strove. Today, we're quite fortunate to have Dr. Benji Osinski with us. He's from the Sleep Health Center up here in Joburg, but I know they recently expanded down to Cape Town as well. They're doing all sorts of exciting things. Him and his colleague, Dr. Alison Bentley, who's pretty much the OG of sleep medicine in South Africa. I'm sure she won't mind us describing her that way.
Not at all.
Um, Benji's got a really fascinating topic for us. We're talking about the link between sleep and mental health, um, which is something I kind of experienced firsthand on Friday, actually, Benji. I the family were up from, I've got some family in White River, and they were up on Friday. We ended up having a little bit of red wine on Friday night. It's not normally something that I do. I had maybe a glass and a half, two glasses perhaps, and woke up at 2 o'clock in the morning on Saturday, sort of heart racing and unable to get back to sleep. Tossed and turned, couldn't sleep. Eventually just got out of bed, did some reading, eventually got on the indoor trainer at 4 in the morning. Sleep was not coming. I actually felt fine that day. But my word was I grumpy on the Sunday. Um, and so I think that was kind of a demonstration of how, this link that exists. So I'm pretty excited to hear what you're going to teach us all about that link and how we can kind of think about it in our daily lives. So yeah, over to you.
Amazing. Jared, thank you so much for having me on and welcome everybody. I think this is really an awesome topic. I think it's very topical. I think a lot of what I'm going to discuss is going to resonate with a lot of people. And I think by the end of the talk, my goal is to help empower everybody, from a sleep perspective, from a mental health perspective, to, provide everyone just a bit of a deeper understanding on how intimately intertwined sleep and mental health actually are. And then I always like giving really good evidence-based advice, tips, and tricks to improve both, to understand, when it's time to seek help. And again, by the end of the talk, which is good news for Jared, everybody will understand exactly why Jared was grumpy over the weekend when his sleep was disrupted. And so, as Jared said, my name is Benji Osinski. I'm a medical doctor. I work at the interface of sleep and mental health. It's really where I'm most passionate. And really looking forward to giving the talk. So let's just look at sleep and mental health in the context of South Africa. So if we look at sleep disorders, 25% of the South African population have got a clinically significant sleep disorder. So I'm not talking about, I struggle to sleep every now and again. I'm talking about sleep disorders that are clinically significant in the sense that they are impacting people's lives and they require medical intervention. Okay, so that's 25%. If we look at mental health conditions, if we kind of add up all of them, all of the common ones as well, we're looking at about a 30% prevalence. So 30% of the population, once again, has a clinically significant mental health condition. Now, everybody's heard of diabetes. We know what a problem it is. And if we compare it to things like this, its prevalence is only about between 6 to 9% of the population. So this is a lot more prevalent, right? The thing that we need to understand about sleep and about our mental health and about sleep problems and mental health conditions is that they rarely travel alone. And it's reported that there is over 50% overlap. There's a 50%, but most likely even higher overlap between sleep disorders and mental health conditions. So we're going to look at sleep problems, but from the context of mental health. So just some stats around that. 75% of people with clinical depression have a sleep problem, a sleep disturbance. 70% of people with anxiety have a sleep disturbance. 75% of people with burnout have a sleep disturbance. And 80% of ADHD patients and people suffering from ADHD have a sleep problem. So that is looking at if somebody has a mental health condition what is the likelihood they're going to have a sleep problem as well? And we can see the statistics are just tremendous. If we look at mental health conditions from the lens of sleep disorders, well, let's take Jared's experience over the weekend. And again, we don't have to be a medical professional to understand. If I had to deprive you all of sleep tonight and I didn't allow you to sleep at all, we all understand tomorrow your mental health's not exactly going to be so robust. So let's dive into that. In people who have insomnia, they have a 2 times, so double risk, double the risk of developing depression. Okay, people with sleep apnea have a 2 to 3 times increased chance of developing depression and anxiety. And now we understand what happened with Jared, why he was so grumpy after poor sleep. So just one night of poor sleep can increase the amygdala's reactivity in our brain. And the amygdala in our brain is really important for emotional regulation. Okay, so less than 6 hours, the part of our brain that regulates our emotions is 60% more impaired than if we had had a good night's sleep. And finally, with the circadian disruption, and we'll talk a little bit about that later, so a mismatch between our brain's clock and the clock of the society in which we live and the time zone in which we live, carries a 3 times increased risk of developing mood disorders. So I think we can see from both angles, these 2 areas of our health, pivotal areas of our health, are so intertwined. Okay, and let's just talk about how they run in both directions. Now, sleep and mental health, they have a bidirectional relationship, both in terms of their development or one causing the other, but also in terms of their treatment. So for example, if we are treating depression and we concurrently treat sleep as well, a sleep problem as well, our treatment for depression is going to be a lot more efficacious, right? Similarly, if we have a sleep problem and that sleep problem results in a mental health condition, by treating the mental health condition, sleep can improve as well. So really, they are so intertwined, both in terms of how they develop and how we can treat them. So if we look at poor sleep, what does poor sleep do? It depletes our mood chemicals, right? We've all heard of serotonin. You may not have heard of others like noradrenaline, like dopamine. They are really important for our mood. It fragments emotional processing. So we've all heard of REM sleep or dream sleep. That's where most of our emotional processing occurs. If that's disrupted, we don't get to process emotionally charged memories as well. It keeps stress hormones high. So again, I'm sure a lot of us have heard of cortisol. So disrupted sleep increases cortisol. That increased cortisol has profound effects in our brain. And that's a massive cause of mental health conditions. Okay. If we look at poor mental health, if we're really struggling with anxiety, everybody knows the first thing that's going to go is our sleep, right? So being in that hyper aroused state as a result of anxiety prevents us from falling asleep. We know that. Our nervous system, so our autonomic nervous system, being our fight or flight response, or our rest and digest, gets disrupted, as well as our endocrine system. So something called the HPA axis, right? And that's really controlling stress hormones and a whole bunch of other hormones. And again, ruminating over negative thoughts or worries, that is a really important symptom in the context of mental health conditions, keeps the brain awake, right? And as I alluded to earlier, so treating insomnia reduces depression, even without antidepressants, okay? Treating depression improves sleep. So that just shows the bidirectional relationship, okay? But of course, treating both gives us the best outcomes. So if we look at sleep problems and mental health conditions, which came first? Well, in clinical practice, most of the time, it's actually very difficult when we see patients who have concurrent mental health problems and sleep problems to understand which came first. So I actually like reframing the question, not from which one has come first, but I like framing this issue as follows. So the more chickens we have, the more eggs get laid. The more eggs get laid, the more chickens hatch. The more chickens that hatch, the more eggs they lay. And so this negative cycle goes. And I'll explain it like this. The more anxious one is, the worse one's sleep gets. The worse one's sleep gets, the more anxious we are the next day. The more anxious we are the next day, the worse our sleep gets. And so really, sleep issues and sleep disorders that exist with mental health conditions The mental health condition worsens the sleep, and the sleep worsens the mental health condition. But on the flip side, we have two areas that we can intervene, where we do intervene and manage both improve as exponentially as both cause each other to deteriorate. So it's good news. Okay, so we now have an understanding how common mental health conditions are. We've got a good understanding of how common sleep disorders are. We understand that in many, many cases, it's bidirectional, right? So one exacerbates the other, and so it goes the other way around. So it begs the question, well, what can we do about it? So let's look at it from a sleep perspective first, right? And this is really a phenomenal questionnaire that was developed, as Jared said, by the OG of sleep medicine in the country, Dr. Alison Bentley, who I am really privileged to work alongside and who I've been trained by. And this is really just a broad screening questionnaire to understand, if one does have a sleep problem, it might indicate that one does have a sleep problem. But, the actionable next step from this questionnaire, if one answers yes to any questions, is to actually go and seek medical attention to address the sleep disorder. So do you sleep less than 7 hours most nights? And what I add to that is, when you sleep less than 7 hours, and if it's happening on most nights, do you feel like it affects your daytime function? Okay. Do you wake up feeling like your sleep was unrefreshing despite having adequate hours of sleep? Does tiredness affect your day? Do you snore a lot at night? Has anyone ever seen you stop breathing in your sleep? That may indicate obstructive sleep apnea. Do you experience an uncomfortable urge to move your legs at night and struggle to get them in a comfortable position? Do you struggle to get enough sleep? And finally, are you worried about your sleep? And if yes is answered, to any of these questions, we recommend going and speaking to somebody about it, a medical professional. Right, if we have a look at mental health conditions, again, some quick screening tools that can be used. Most of them are self-administered. So you can look these up on Google. You're welcome to take a picture, but just, at a high level. So depression, so there's something called the PHQ-9 questionnaire, which is really, really good. Anxiety, there's another questionnaire. There's a questionnaire for burnout. Okay, there's ADHD questionnaires, and again, self-reporting. I like to add in here, if answered yes to any of these questions, seeking help is for the strong. It actually takes a lot of strength to put your hand up and say, I need help, and go and take steps to address, whatever struggle you're going through. And that's really important. So, if you are concerned about your mental health, please go visit your GP, local clinic, psychologist, psychiatrist, your company's corporate wellness, if they've got that program, employee assistance program, and Strove has some phenomenal avenues, but really at a high level to understand that if you are struggling, despite, you can do a questionnaire if you're unsure, but if you intrinsically know there is an issue, putting up your hand and saying, I need help, and taking steps to improve your mental health really is an act of strength and not weakness. So once we've kind of made an assessment and, we've either gone and, resolved our mental health condition or our sleep disorder, once we start looking at optimizing our sleep and our mental health, there are some basics. And I think it's important at this point just to take a step back and pause, because in this day and age, with social media, with just an abundance of infinite information, on a daily basis, we are bombarded with information. We are bombarded with the next big craze. Every time we go on social media, it's somebody telling us that the reason for all of your life's trouble is broccoli, right? Broccoli is the worst thing you could eat. And then you get another person saying, no, broccoli, you should only be eating broccoli. Then someone saying seed oils is causing all of your medical, mental health, and sleep problems. And it just becomes an absolute mess. And we don't actually know what is truth and what is not, right? Just because somebody has a lot of followers on Instagram doesn't necessarily mean that the information they are providing is evidence-based and is accurate, right? And so there's a whole lot of hacks and all of these types of things. But when we remove the noise with basics that everybody can be doing, and I can, hand on heart say each one of these things is rooted in evidence and will help. And once these pillars are in place, they make a tremendous difference. And so first, lock in these pillars. Once these pillars are locked in, one can start looking elsewhere. But, trying to, do some sort of a sleep hack or mental health hack, when these things are all absolutely just out of whack, it's like, putting a plaster over a gunshot wound. Get the basics in place and you'll be surprised the outcomes that these will achieve. All right, so firstly, sleep, right? The foundation. Every other pillar depends on it. If we do not sleep well, the evidence shows the next day, it's very difficult to maintain a healthy diet. And from a metabolic perspective, a whole lot of processes just become deranged. If we don't sleep well the next day, well, exercise is very difficult. And again, if we don't sleep well, relationships take strain because, we're not in a good place and we're grumpy and it's very difficult to have patience and all of those kinds of things. So we'll go more into sleep, but at a high level, good quality sleep, the right amount of hours that are personal for you, good regularity, going to bed and waking up at around the same time, and a good routine, which we'll discuss a bit later. And then diet, which is probably the most messy out there, right? Because we just fed so much information. So again, just removing the noise. What's important about diet is a few things, right? There is, and we'll talk about it just now, the gut-brain barrier, really important, right? Our gut microbiome, all the bacteria in our gut that are super important for our overall health and our mental health. And then again, food is fuel. So whole or minimally processed foods, I think everybody would agree on that. Enough macros and micros, so macros being carbohydrates, protein, and fats, and ensuring good sources of those, and then looking at the gut-brain axis. And again, I'm not an expert in diet, but what's really important here is fiber. So fiber is really important, okay? And then exercise. Exercise is medicine, okay? And we'll talk a little bit later about a really, really important chemical in our brain called BDNF, brain-derived neurotrophic factor. So exercise is the most potent stimulator of brain-derived neurotrophic factor, which is super important for our cognitive health and super important for our mental health, right? So exercise is really important. So 150 minutes of moderate activity per week, any movement counts. An important thing in the context of sleep is to finish exercising at least 3 hours before bed. If we're going to be doing really intense exercise, I would recommend, having that done at least 5 to 6 hours before bed. And then another thing that doesn't get spoken about enough is relationships. Social connection is a biological need. It is not a nice to have. And we live in a world where connection through technology is easier than ever. But paradoxically, it causes severe loneliness. And so good relationships, in-person relationships, are really important for our health. And I'll show you some just shocking statistics on that a little bit later. So prioritize quality over quantity. One really good relationship is a lot better than 25 superficial and potentially toxic relationships, right? Try and have one meaningful conversation a day. Protect your relationships and they will protect you. So those are really the 4 pillars, sleep and mental health, that I think everybody will agree on. Then we look at sleep. And once again, sleep is becoming highly topical and we are bombarded on a daily basis, right, of all of these hacks for sleep. You see people now wearing yellow glasses and then the next day they're wearing red glasses. And then the next day you have 5 people all telling you about their sleep stacks and of course trying to sell them to you with a whole bunch of supplements. So I rely on the Pareto principle, and the Pareto principle states the following. So it's a phenomenon that works across so many domains, this being one of them. And it states that 20% of effort will get you 80% of results. The remaining 80% of effort will only achieve the remaining 20% of results. So if we look at the 80-20, what's the 20% that's going to get us 80% of the way there? And I'll be honest, in most cases, usually gets us all the way. So same wake time daily, every day, no matter what, even on weekends. Now, again, of course, there's practicality. People have children, people have babies, life is life. And so from a practical perspective, try and do this as much as practically possible, okay? The next thing is morning light. Morning light is a legitimate thing. Okay. And so, obviously in winter it can be a bit difficult, but as early as possible when the sun is out in the morning, just get some sunshine. I like to call it, 15 to 20 minutes of photosynthesizing in the morning. Okay, that sunlight helps wake you up properly. It helps align your circadian rhythm. It's really good for mood as well. And of course, vitamin D, which is really important. Okay. What is a lot better and cheaper than a whole lot of supplements is a wind down routine. You have to remember, sleep is not an on-off switch, all right? We don't go from awake to asleep just like that. And a lot of people, are lying in their bed on social media doing work. They put it away, close their eyes, expect to fall asleep within 10 minutes, and then they wonder why their brain it just can't switch off, right? So instead of asking, what can I do to switch off? Rather ask, how can I facilitate the gentle and fragile transition from asleep to awake? And that looks like making our environment darker. That looks like putting screens away. That looks like not being in our bed just yet. And it looks like doing something relaxing. And if you do that consistently at around the same time, you'll be surprised how powerful that is. Okay. Also important to understand that caffeine has a half-life of about 6 hours. So the way I describe it is this. Most coffee that we get, we drink is about a double espresso based drink, right? And if we have a cappuccino, that usually contains a double espresso, let's say at about 2 p.m., okay, 6 hours later, which is 8 p.m., the amount of caffeine that is still in our system is the equivalent of one shot of coffee. And then I asked you, if you're targeting a 9, 10 p.m. bedtime, does it sound logical or reasonable at 8 p.m. to have a shot of espresso? Absolutely not. So it's important to understand the half-life of caffeine. And then finally, and once again, I think Jared will attest to this, no alcohol near sleep, right? Alcohol absolutely obliterates sleep in many different ways. And so I would really avoid alcohol in general, but certainly right before bed. Okay, now the noise, blue light blocking glasses, melatonin, unless it's been prescribed by a doctor for a particular condition where melatonin is indicated, CBD oil, valerian, chamomile, weighted blankets, binaural, all of these other things are the 20%. Now, if somebody, I'd say, except with the exception of melatonin, is doing any of these things and they feel like it's really good for them and it helps them and they're sleeping great, by all means, please continue. But if, the left side of my screen, that 20%, the really important pillars are not being adhered to, all of the other things, the remaining 80% of stuff is just really not going to do much. Okay, so some nice tips and tricks and tools that help improve both systems. So that is both sleep and mental health, that are pretty much all three, okay, which is great. And they both work to improve sleep and mental health simultaneously. So the first is scheduled worry time, right? Life is intense, guys. It's really hectic, and there's so much to worry about. But having anxiety kind of intrude into our thinking throughout the day is really counterproductive. And so a really nice trick is to schedule worry time. And what that looks like is saying, right, this particular time of the day, whenever that may be, that is when I'm going to stress. And that's when I'm going to think through all of the things that are stressing me. And, ideally, you want that scheduled worry time to be done, prior to your wind down routine. And if you do that consistently and practice it, it takes time to develop that discipline. Well, you stop worrying during the day because you say, listen, something has occurred that's going to stress me. It's fine. I will worry about it later. And that really helps to relieve anxiety. It's not that you are, sweeping things under the rug or you are avoiding things. It's saying, right, I'm scheduling time to think through this. And the next really powerful thing, and I recommend doing this just before one enters their wind down routine, is to write a to-do list of tasks and things that are stressing you out. And you do that as an exercise just before you enter your wind down routine. And the act of writing it down helps take it away outside of your head so you don't ruminate over it. And it's a really powerful practice to do. The other thing, it still allows you to maintain control over everything, which is also very important in anxiety. The next thing is, and again, leveraging some really high impact practices and exercises. There's unbelievable breath work, yoga nidra, when you look at that, why is a doctor recommending Yoga Nidra? Some incredible evidence around it, and I've done it myself. It's actually crazy how amazing it is. Meditations, experiment. All of these things, are really gathering a hell of a lot of evidence and are really powerful. As we've said, morning sunshine. I recommend avoiding alcohol entirely. There's just no use. There's just absolutely no case for any alcohol. We've heard previously, 1 glass of red wine is good because there's polyphenols and antioxidants in it, but the alcohol in that wine pretty much cancels out whatever benefits we're getting from it. And again, alcohol near sleep, not a good idea for your mental health or for your sleep. And then once again, exercise. The type of exercise aligned to what you are able to do, what you enjoy, and timing of exercise is important, and not doing it too soon before bed. So if we have a look now, we've spoken about the cause, coming from a mental health lens, from a sleep lens. But let's look what happens if we start improving these important pillars of our health. So the evidence is unambiguous. Sleep is a treatment for depression. It's not just a symptom of it. Okay, so we get a 50% reduction in the severity of depression from treating insomnia alone. Okay, we are 2 times more likely to achieve full remission from depression when sleep improves during treatment as well. And again, treating sleep apnea is a tremendous way of improving depression. I see so many patients who have sleep apnea where, from the outside, they look clinically depressed, and it's literally just the sleep apnea. But of course, sleep apnea can also coexist with depression. Now, sleep apnea prevents a lot of depression treatment from working. So that's really important. And treating sleep apnea really helps in whatever other treatment that we're giving patients for depression. Okay, so we know sleep restocks mood chemicals. REM sleep helps us to process emotional memories. And sleep is really important for something that we call neuroplasticity, the ability of the brain to form new connections. And sleep is really important for, remember I spoke about BDNF, brain-derived neurotrophic factor, to take effect. And so really, really important. Better sleep, less anxiety, we know that. So we all know if we've had a bad night's sleep, we are more anxious the next day. And that's once again been proven through research. So after just one bad night, we have a 30% increase in our anxiety levels. Okay, 60 to 70% of patients, right? The anxiety improved tremendously with just CBTI, which is how we manage insomnia in many cases. And we spoke about that 60% increase in amygdala reactivity, right? Amygdala is our alarm system, our danger system. It helps regulate emotions, and our amygdala becomes dysfunctional when it hasn't had a good night's sleep. Okay, and of course, it goes the other way. If we've had a good night's sleep, we get the same improvement. So really important. There's a lot of talk around resilience and emotional resilience and resilience in general. Okay, so when people sleep well, okay, it's not that we just feel better. We are measurably more resilient under stress. Okay, and that's in part because of amygdala reactivity. It's such a crucial part of our brain. When it's had a good night's sleep, it's fantastic. And so when people aren't sleeping well and they have a sleep disorder and they're struggling to regulate their emotions, what I always tell them is, it's not a you thing. You are not the problem. It's your brain. Your brain is not getting what it needs. And again, resilience is built at night. So 40% lower emotional reactivity in well-slept people when faced with the same stressor. So if you take 2 groups of people, you give them the same stressor. One group has had good sleep, the other has had poor sleep. The group with good sleep is going to be able to operate a lot better under stress, almost 50% better under stress. Now, again, REM acts as overnight therapy. And the way I explain it is REM is a safe space in your brain to work through and process emotionally charged memories without the fear, without the stress, without the anxiety. REM is really therapy for us. It's overnight therapy. And so if we have good sleep, and REM is an important component within how we judge quality, it's a very important stage of sleep. So if our sleep quality is good, meaning our REM sleep is good, we're getting a good dose of therapy every night. Okay, what you eat affects how you feel, and this speaks to the diet component, right? So what you feed your gut is what you feed your mind. So 33% lower risk of developing depression when one has a Mediterranean diet. Mediterranean diet, meaning whole foods, low in saturated fats, good protein, low glycemic carbs, good fats, all of those great things. So the gut has its own nervous system, right? And it's been coined the second brain. It talks directly to your brain through the vagus nerve, right? It also talks to your brain through the gut microbiome. And the bacteria in your gut actually produce very similar neurotransmitters and chemicals as in your brain. So very, very important. Also very important in inflammation. And so, having the right food, while of course it's about nutrition, while of course it's about, cardiovascular risk, when it pertains to sleep and to mental health, it is crucially important as well. Okay. Exercise is medicine for the mind, right? If we have a look at exercise as an intervention for depression, 30 minutes of exercise 3 times a week was shown to be as effective as antidepressants for mild to moderate depression. Now, that's not to say that, we have to throw away all medication and just do exercise. There are many cases where exercise is needed. But what would happen if we use both as an intervention where it's needed? Really, really powerful. So exercise does a whole host of things. As it pertains to sleep and to mental health, well, if we've had an exercise session, we all agree we feel great afterwards, right? Our anxiety is less, our mood has improved. And a lot of it has to do with BDNF, right? BDNF, brain-derived neurotrophic factor, right? Think of it like fertilizer for your mind. BDNF helps in so many areas, and exercise is the most powerful non-pharmacological, so non-medication intervention we can to improve BDNF. And so exercise deepens sleep as well. So regular exercise increases slow wave sleep or deep sleep, which is another stage of sleep. That's really important for physical recovery. It's really important for mental health. And if we, look at another really cool stat, so a single session of exercise improves mood and anxiety, okay? And consistent exercise, it's not just about chemicals, it's about structural brain changes that last. So now looking at stacking exercise, improving our sleep and diet can have tremendous effects, and they of course stack. So now if you want to talk about a sleep stack and a mental health stack, we've reframed it. The difference is these are things we have to do, not things that we take. And finally, relationships are a biological need. I've triple checked the stat because it is just so outrageous, but it's true. So social connection is not a luxury. Loneliness is not only one of the strongest predictors of poor mental health, it's also a very strong predictor of poor physical health. So how's this? 15 cigarettes a day is the equivalent risk factor of loneliness as it pertains to our mortality risk or risk of death. So basically, loneliness carries the same risk of mortality as 15 cigarettes per day. Crazy, right? And loneliness raises depression risk by 29%. So social isolation, right? It's one of the strongest modifiable risk factors for depression and anxiety. Okay, connection regulates your stress system, your nervous system. So positive social interaction suppresses cortisol, and we know cortisol is the stress hormone. It activates the parasympathetic nervous system, the rest and digest nervous system. So a lot of us, throughout our day, we're in fight or flight, and that's the sympathetic nervous system, right? That's the nervous system that gets activated in response to danger, and good social connection helps us flip from the sympathetic nervous system being the fight or flight to the parasympathetic nervous system, which is our relaxation, our rest, and our digest. And again, it's the quality that matters more, right? And, what's really cool, and I'm seeing, all around, is exercise is becoming a social activity. So there's run clubs, there's high rocks, there's so many of these unbelievable things. And so it becomes quite easy to, achieve multiple pillars at once, right? So exercise and social connection, there's so many places that we can do that hand in hand, and it's just amazing. So again, when should one seek help for your sleep. So, self-help is powerful, and there's a lot that we can do on our own. And as I alluded to Alison's 7 questions earlier, there are some red flags that if they exist, one should seek help for their sleep. So loud snoring, and if your bed partner says that you stop breathing in your sleep, some people actually wake up from it. That needs to be assessed. Using sleeping tablets for more than 4 weeks. There's a lot of people that are on sleeping tablets chronically. That's something that needs to be addressed. Acting out dreams or waking in terror. So that speaks to what we call parasomnias. So abnormal behavior during sleep. Restless legs, very, very important. It's not just a benign thing. It affects sleep a lot. Difficulty falling asleep, difficulty staying asleep, and just a persistent feeling of fatigue, tiredness, sleepiness, despite, sleeping 7-8 hours a night. All of those are indications that one should seek help for their sleep. Okay. And then again, from a mental health perspective, just some red flags. If one is unsure, these can help assist you. But, for a lot of the time, people are aware they are struggling. Sometimes people are not. I always say, err on the side of caution, seek help. It's an act of strength, not weakness. So a low mood, or loss of interest in things you would normally be interested in lasting more than 2 weeks, that's an indication. Feeling emotionally numb or detached, using alcohol or substances to sleep or to cope or to deal with stress, that's really important. Anxiety that's interfering with daily life, so functioning at work, functioning at home, intrusive or unwanted thoughts you can't control, or anger or irritability that feels like you cannot control it, or that's out of proportion. And once again, I've put some helplines here. Please, if you are concerned, go and seek help. It's for the strong. And so I hope after this talk, we've got a deeper understanding of sleep and how important it is, a deeper understanding of mental health and how important it is, and just some really powerful evidence-based interventions and pillars that we can start implementing in our daily lives to improve both, but also to understand, when self-help is just not sufficient, when to go and seek help. So thank you so much. Hope everybody gained value from this, and I hope you enjoyed the talk.
Wow, Benji, thanks so much. I think you've outdone yourself there. It was a really, a lot of information, valuable information there to take in. I just wanted to, before we get to any questions, I wanted to highlight the fact that, you are in partnership with Strove now. We've actually published your pathway in the app, which is kind of a 6-week program that can help users to sort of learn a little bit more and start improving their sleep with some practical kind of exercises and things, and a few meditations and a bunch of other content in there as well. So please check that out. If you just tap the plus button, you'll see pathways there, and Benji's pathway is really amazing. And for those who have access to talk, I mean, you can actually book consultations with Benji for, clinical sleep problems if you feel that you need. And that's maybe where we can start here with the questions, because I think Bongani was asking about, not being able to sleep much more than 6 hours per night. And, last night only falling asleep at 3 a.m. And, if someone needs a kind of a clinical investigation into sleep, like what does that entail? So what are the next steps for someone like Bongani who's a little bit worried?
So, first step is to have a consultation. I think there is this misconception that when people are struggling with their sleep, and specifically with insomnia-like symptoms, that they immediately need to go and have a sleep study. And that's usually not the case. And we have a multitude of different ways of testing sleep. We've got our obviously in-facility sleep studies, and we've got home sleep tests for sleep apnea. But by and large, step number one is to have a consultation, because as doctors managing sleep, we have to look for medical conditions that could be disrupting sleep, substances and medications disrupting sleep, and mental health conditions disrupting sleep. And we've got to work through those before we come to a diagnosis of a primary sleep disorder. And so before just jumping to an investigation, 99% of the time when I'm working with somebody who has primary insomnia, they don't need a sleep study at all. So step number one is a consultation for sure.
Yeah. No, I think that's good advice. And then, Bongani and Katlego were both asking about like specific sleep aids, warm milk and cinnamon or essential oils. And I don't know, from my side, it feels like they're falling into that 80-20 trap that you were speaking about, and what's your opinion there? Do they maybe need to have a look at that 80 side before thinking of the 20 side?
Absolutely. So I think just to break it down, what's really important to note, there is no supplement or hack that can cure insomnia or a sleep disorder. Okay. And so if somebody does have a sleep disorder, it requires medical intervention. Now, that may not necessarily mean medication, but it needs intervention, right? If somebody does not have a sleep disorder, or if they had one and it's been managed, at that point, one can look at all of these other things like optimizing, and that becomes highly personal. So there are people, a warm glass of milk before sleep is really good. Other people where, they need background noise, so they put on a podcast to fall asleep. Others need absolute silence. Then we start looking at, what's really personal for each individual. But it's important to note that, if there is a clinically significant sleep disorder, so a circadian rhythm disorder, insomnia, sleep apnea, restless legs, all of those types of things, there's nothing that can resolve that outside of, medical intervention.
Okay, yeah, that makes sense. I think we can maybe roll this next question into one. So Angela and Gillian. Angela was asking about menopause affecting sleep, and Gillian about obesity affecting sleep. And I think the answer for both of those is yes, but maybe you can give us some more information on how that's true.
Oh, 100%. So menopause, there is so much that affects sleep. So firstly, in the perimenopausal period, so the time at which women are going through menopause, there are many things that happen. So number one, the reduction in the production of estrogen and progesterone in and of itself can disrupt sleep. Estrogen and progesterone are crucial hormones for sleep onset, so falling asleep, and sleep maintenance, staying asleep. So that's number one. Number two is vasomotor symptoms, so the hot flushes. People are familiar with that with menopause. And even if women are not experiencing those vasomotor symptoms during the day, the vasomotor symptoms, even when subtle, can completely disrupt your sleep through a variety of mechanisms. One of them is just body temperature, right? So we need our core body temperature to be below 1 degree Celsius to go into deep sleep. So those vasomotor symptoms can wake women up. The other thing is that as one gets older, one's production of melatonin decreases, which happens at around the age of menopause. Finally, as everybody gets older, one's risk of developing sleep disorders increases. I said finally, there's actually one more. But what also happens is as one approaches, 55, 60, what starts to happen is our need for sleep in terms of hours actually reduces.
Yeah.
And so if you put all of that together, yes, there are many women who go through menopause and their sleep is fine, but there are many where menopause is a really powerful precipitant of sleep problems that then occur during and after menopause. Absolutely. Yeah. From an obesity perspective, I think just at a very high level, so because we want to get through questions, increased BMI increases the risk of sleep apnea quite proportionately. And so if we do a risk stratification questionnaire called the Stop Bang for sleep apnea, the B is for BMI, and a BMI above 35 is a risk factor for sleep apnea.
Yeah, okay, I think that'll suffice. Johan was asking about the stages of sleep, light versus deep versus REM, and we all get this data on our wearables every day, and he's asking about sort of are there specific minimum recommended times for each stage, and how important is that? And something that comes to mind there is kind of this condition of orthosomnia and how people might get a little bit too tied up in some of that data. What can you say about wearable data?
100%. So it's important to note that the only way to accurately measure sleep stages is something called a polysomnogram. And that's, I was referring to that earlier in terms of the overnight sleep study with electrodes on your head, because the way we stage sleep is through brain waves, right? And electrodes on your eyes and everywhere, right? Wearable data can be extremely inaccurate, right? And you can see it right off the bat. If you don't have things connected to your head, our rings and our watches are not measuring brain waves. So number one, it's important to note that these can be inaccurate. The second important thing to note is there is night to night variability, and that's something that's natural. So we can't look at, I need the exact right amount of each stage of sleep every night. It's not biologically possible. It doesn't happen, right? Your brain, outside of medical, mental health, and sleep disorders, usually will give you, enough of what you need. And if we look at what is, kind of needed at a high level in terms of sleep stages, so light sleep will occur for about 50 to 60% of our sleep time. We look at deep sleep to be around 20%, 15 to 20%, and REM sleep about 20 to 25%, right? And again, it varies. So if someone's waking up, and they look at their wearable data and they say, oh, damn, I only got 12% deep sleep, does it really matter? Most likely it doesn't. However, if for the last 6 months, your wearable device is saying you've gotten 1% deep sleep, that's something to look at. Outside of the wearable data, I recommend first actually subjectively assessing how you feel. Really cool research that was done. They took a group of people, one group of people, they told them that their sleep was really bad. Like they did a measurement and lied to them. The other group of people, they said your sleep was phenomenal.
Yeah.
Irrespective of whether their sleep was or wasn't, obviously it was mixed. The people who were told that their sleep was really good performed better in the cognitive function test than the people who performed worse. And so, if your wearable is showing you something you are concerned about, please go and get that checked out. Okay. It's not like we mustn't look at the data at all, or the data is absolutely inaccurate or irrelevant. So if you are concerned, absolutely go and see someone to have a look at it. But if you feel great, everything is fine, don't take it too seriously.
Yeah. I wonder what the ethics committee meetings were like in that study. Lying to people about their data, that must have been interesting. But it ties into kind of this link that you described between anxiety and sleep, and people then being anxious about not being able to sleep, and that anxiety then preventing them from sleep. I think you provided that sort of scheduled worrying time as one tool that you might use there. Is that the case, and are there any other ways of kind of breaking that cycle?
Yeah. So that's a phenomenon, as you mentioned, Jared, called orthosomnia, which is effectively, it's a phenomenon where worrying and trying to achieve perfect sleep data causes anxiety and paradoxically makes your sleep worse, because we know sleep and anxiety cannot exist at the same time. And I often speak to patients and I say, if I said to you, I'm going to give you R1 million, all you have to do is run 10 kilometers. You'd push yourself and you'd run those 10 kilometers. If I said to you, I'm going to give you R1 million, but you have to sleep perfectly tonight, what would happen? The exact opposite would happen. You wouldn't sleep, right? Yeah. And so sleep is very different in that regard. And I see a lot of patients with orthosomnia. It's becoming more and more prevalent. And, the type of person who is usually predisposed to developing orthosomnia is, really, really anxious person, A-type personality, as we call it, and they can really spiral. And I say to them, as a rule, when we have our first consult, you are taking the wearable off for the next 6 weeks. That's step number one. Because the easiest way to fix your sleep, if it is being disrupted by anxiety, is to remove the source of the anxiety. Now, sometimes that's very difficult, okay? It's not as easy as just doing it. But in the case of orthosomnia, it actually is. And if you remove that source of anxiety, which is your sleep data, it's amazing to see how those types of people improve.
Yeah, that's fascinating. Okay, I'm conscious of time. Maybe we've got time for one more because it's really interesting. Estine is unfortunately blind, and so obviously doesn't know the difference between dark and light. Like for someone like that, what does the research show about how her sort of day-night cycles are regulated? Is there anything that she can do to help? Does morning light is it still important for her? Some pretty fascinating implications there.
Yeah, very, very fascinating. And so this speaks to the circadian rhythm. And our circadian rhythm is our brain's internal clock. It's governed by a part of our brain called the suprachiasmatic nucleus. Okay? No one has to remember that. Okay?
You're just showing off.
A bit of a word salad. Not at all. Okay, so it's the brain clock. And what research has shown is our brain keeps its own clock. And it's pretty much 24 hours. Research has shown a little bit more. And so what controls your circadian rhythm is I don't want to sound fancy now, Jared, that part of your brain, the clock's internal capacity to keep a 24-hour clock,
Yeah.
which it does, and it's governed by a whole lot of different genes and proteins. So you have your intrinsic circadian rhythm. Then it can be manipulated, changed, but also entrenched, which is what we want, entrained, by what's called Zeitgebers. And Zeitgebers is German for timekeepers. Now, of course, light and dark are very important Zeitgebers. And again, depending on what the cause of the blindness is and if those cells of the retina are still sensitive to light, I mean, I wouldn't know. But they are not the only Zeitgebers.
Okay.
What are other Zeitgebers? Those are things like exercise, meal timing, right? One can still relax and wind down, if the cells that respond to light, are impaired. And so there are other Zeitgebers in the absence of light and darkness that can be leveraged to help entrain the circadian rhythm. That being said, that the suprachiasmatic nucleus, that part of our brain, has its own internal system. And, we see that in circadian rhythm disorders where, someone's circadian rhythm has completely shifted and it's causing a lot of distress. And that's that internal part of their brain being programmed. And so, yes, internal, it has its own internal control despite light and dark. But outside of light and dark, there are other Zeitgebers that can be leveraged. Temperature being one of them as well, right? Getting cooler in the evening and getting warmer in the morning. So circadian entrainment is absolutely still possible.
Yeah, fascinating. No problem getting cooler in Joburg at the moment. It's been pretty chilly, both in our jackets. But yeah, I think that's all we got time for. And I just wanted to thank you again for joining us and sharing your knowledge. Really, really fascinating on a topic that's so important. I mean, didn't quite get through all the questions, but as always, we'll need to get you back for another session. Yeah, thank you, and thanks everyone for joining. Have a good afternoon.
Thank you so much, Jared. Thanks everyone for joining. Really appreciate it.
Thanks, Benji.
Cheers.